So breast cancer cells, and for that matter breast normal cells of the breast, they have receptors of the hormones, the estrogen and the progesterone, which are the normal hormones for the females. So whenever the breast cancer develops, in a significant percentage of these patients, there are receptors present on these cells which normally respond to these hormones by increasing or decreasing the cell turnover whenever there is an exposure. But we have exploited this particular part of the breast cancer biology, that whenever these cells are positive for these receptors, which are known as estrogen receptor and progesterone receptor, we try to block these receptors by giving some medicines, and that helps us in controlling the tumor.
So, under what circumstances should patient get targeted therapies and immunotherapies?
Hormone therapy is the first targeted therapy that came into the clinical use, but now these days the term targeted therapy and immunotherapy is reserved for something different. So if we call hormone therapy, this is hormone therapy which targets the receptors, and these are medicines, oral medicines, they are pharmacological medicines. As far as targeted therapy and immunotherapy is concerned, they are monoclonal antibodies, which are again a type of drugs used in the cancer therapies. They target the specific characteristics of the cancer cells, and that's the targeted therapy. And we have an HER2 targeted receptor. Towards there is a drug called trastuzumab, which targets particularly those receptors, and about 15 to 20% of the breast cancer cells are positive for these receptors, and then we use the targeted therapy. Coming to the immunotherapy is a drug which basically improves the immunological attack on the cancer cells by the body. The term immunotherapy, some people mistakenly use this term for those drugs which increase the immunity of the person so that all the infections are taken care of. It's not that. Cancers and tumors, all tumors for that matter, they secrete some substances which decrease the immunity attack of the cancer cells of the persons. So these immunotherapy drugs go and target these particular substances in the cells, and then help the body immunity cells to come and target the cancer cells to kill them. So that's what is immunotherapy.